it causes some kids to get sick quickly, they're responding to treatment very well, and they seem to be recovering quickly.
New at 5 tonight, new information about that mystery illness that's affecting hundreds of kids in a number of states now. It looks like it may be in Connecticut tonight as well. We're going to talk with the local doctor who's treating those possible cases right here in Connecticut. Hi, everybody. Glad you're with us tonight. I'm DARREN KRAMER.
And I'm Ann Craig. Now, we first told you about these possible cases of what's now being called EV68. We told you about it Friday night at 11 as breaking news. Well, for the very latest, we go live now to News 8's medical reporter, JOCELYN MAMINTA. She joins us from News 8 Control, and she's talked to that doctor that's treating those young patients. JOCELYN?
Well, and Darren, first thing, do not panic. Dr. Nicholas Bennett at Connecticut Children's Medical Center says this is a lot less serious than the flu. And Enterovirus 68, he says, is relatively easy to manage and does not cause major complications.
It appears Enterovirus 68 cases are declining in the Midwest, where EV68 was first detected. But the numbers are increasing as it fans out to the rest of the country.
My suspicion is we're probably heading into a timeline where we're going to start seeing more, and then we'll start seeing less.
Pediatric infectious disease specialist Dr. Nicholas Bennett at Connecticut Children's Medical Center treating up to 8 potential cases of EV68. He says there is no clear answer as to why children are more vulnerable. EV68 is related to the virus that causes the common cold.
As you can see how similar they are structurally.
Symptoms can start with runny nose, coughing, sneezing, and fever. But EV68 leads to wheezing and trouble breathing, especially among those with asthma.
So it may be that this is a slightly drifted or mutated strain.
With signs of EV68 in Connecticut, he prescribes a proactive approach.
If your child is at risk of developing respiratory problems, if they have a history of asthma in particular, make sure you've got the medications you need on hand.
When should you head to the doctor or emergency department?
In young babies, signs of respiratory distress would be nasal flaring, where the nostrils are opening up wide as the kid's struggling to breathe. They may have retractions, which is where the skin is getting sucked in between the ribs and under the ribs, and breathing hard and fast.
Courtney is on high alert.
Just making sure everybody's hands are clean and keeping everyone safe.
She has 3 children with asthma, including little Sierra.
What's it like to have asthma?
Bad.
Bad? What happens?
We get sick a lot.
Other parents are also keeping a close eye.
I guess I'm just worried about them getting a cold and not being able to get rid of it.
Dr. Bennett is waiting for test results from the CDC to confirm the cases are indeed EV68. That could come in a few days. Darren and Ann will keep you updated on this story.
Well, JOCELYN, the doctor mentioned having those medications that you need on hand, but is there any specific medication to treat this?
No, they really can't treat the virus, but they can manage the symptoms with asthma medication. Now, prevention, I can't stress it enough. Wash your hands. It is spread by coughing and sneezing. If a child is sick, that child should stay home. Do expect more cases. 2 hospitals in our state already reporting potential cases. Now, key to this is that wheezing, that forced breathing and hard noise you can hear without a stethoscope. Darren and Ann?